Neurology plays a significant role in the care of patients with intellectual and developmental disabilities, or IDD. There is a known association between seizures and autism spectrum disorder. These neurological conditions can coexist with IDD, which can make it challenging for healthcare providers to manage issues related to seizures. Collaborative care involving neurologists, developmental specialists, and other healthcare professionals is essential for a holistic approach in managing the health of IDD patients. Subclinical seizures, which may not have obvious external signs or convulsions, can also be associated with autism spectrum disorder, or ASD. These seizures may only be detectable through EEG recordings. Detecting and understanding subclinical seizures in individuals with ASD can be challenging and often require specialized medical evaluations, including EEG, often with MRI of the brain. Since seizures can affect brain function, subclinical seizures in IDD patients may contribute to changes in behavior. Since these seizures may not have obvious external signs, they can be challenging to identify. Seizures, even when subclinical, can affect cognition and behavior in patients with ASD. Understanding and addressing both the seizures and associated behavior often requires collaboration with neurologists and other professionals experienced with autism care. EEG monitoring can help in diagnosing and managing seizures. However, obtaining an EEG for an IDD patient can prove to be challenging due to difficult behavior. Pre-planning and coordination of the healthcare staff is crucial to support an IDD patient through the diagnostic process.
In some instances, seizures can be associated with changes in emotions and behavior. Seizure symptoms can vary widely and can include staring spells, nausea, dizziness, disruptive sleep, complex behaviors, changes in mood, and sometimes confusion. Some patients with ASD or IDD may become overwhelmed with their environment and therefore engage in staring spells as a coping mechanism to help block out the excessive stimuli. This type of behavior must be differentiated from absence seizures, which can be common in children and characterized by brief staring spells. If staring spells are frequent or concerning, it is important to have a medical evaluation to rule out neurological issues to ensure proper treatment. Anticonvulsant medications can be used to treat seizures while also helping with mood stabilization in some patients. This type of medication requires close monitoring from the healthcare team to ensure there are no unwanted or serious side effects. Parent and caregiver observations are crucial to determining whether or not a medication is working properly, especially when working with nonverbal patients or those with limited communication. A seizure disorder can seriously affect a patient's quality of life if not treated properly. Therefore, it is important to understand the differences between behavior and a seizure disorder. An important law to be aware of regarding seizures is the Niels' Law, which was enacted in 2003 after a 32-year-old intellectually and developmentally disabled woman died after developing high fever and difficulty breathing in a group home. Because 911 was not called, she did not receive medical treatment in time, and she unfortunately passed away. The law states that 911 must be called when there is a life-threatening emergency for an individual with IDD. Some seizures are considered life-threatening if they occur for the first time, last longer than 5 minutes, occur back-to-back, result in serious injury, cause the person to stop breathing, or if they occur in someone pregnant or with diabetes. For these reasons, you may see IDD patients coming to the ER for evaluations that are sent by a school, group home, or facility.
Seizures can be more prevalent in patients with IDD. The approach to managing seizures in such cases typically involves a combination of medications, lifestyle adjustments, and at times behavioral interventions. Each patient has their own unique set of challenges. Therefore, consulting with different specialists can assist with a comprehensive seizure treatment plan for IDD patients.